we are doing a semester-long immersive learning course, which consists of testing different liquids, the thickness of the liquids, to help clients who may be on thickened liquid diets, who have a little bit trouble with swallowing. Something a lot of people don't know is that the thinner the liquid, the harder it is to swallow. So we are thickening the liquids so it's easier for people to swallow that have difficulty with it. And we're testing the viscosity of the different liquids, and we're paired with a community partner, which is at Ball Hospital, to hopefully share some useful information to the clients there.
We want to test and just see how the different protein shakes react with the thickeners in order to better benefit the patients in the hospital. Just see how those protein shakes react with the thickeners.
The reason you need to test the liquids is kind of to get an idea of how thick it is, because different patients with different abilities to swallow liquids or foods have different abilities to swallow different thicknesses, if that makes sense. So one patient may need a super thick liquid, like a pudding thick liquid, and one patient may just need slightly. And so learning about how to test that to make sure it fits the needs of the patient.
Some reasons people might need a thickened liquid diet is if they have throat cancer, or if they have dysphagia.
If their muscles aren't strong enough to contract and move the bolus, so the liquid down their throat and into their esophagus, it can they can choke and aspirate on the liquids or the food. So it's really dangerous. So the thickened liquids make it easier for them to swallow, and the muscles don't have to be as strong. First, we chose our supplements, and then you test them unthickened, and then you thicken them with different thickness packets. And one of them is a mildly thick, moderately thick, slightly thick, and then it just goes on from there.
You can either do an IDSI flow test, which is where you put the liquid into a 10 millimeter thing, let it drain for 10 seconds, and then test it again and see how much is left. Or you could do what we were also testing through a viscometer, which tests it for 23 minutes. It gives you the different thickness and temperature and a bunch of different data points over the course of 23 minutes.
I think it's really fun to just be able to mix the liquids. It's it almost feels like a science experiment, so it's really fun. I think that the knowledge of dysphagia and just mixing liquids and the importance of the factors of the temperature of the liquid and the mixing method, those are really important, and being able to provide that knowledge to people that may not know that, people that aren't necessarily in this field of speech-language pathology, it's very important to see how the protein shakes react to that. And this class has given me an experience and knowledge of dysphagia that I would not have gotten without taking this class.
It's working with other speech pathology students to create a presentation and working really hard all semester, and also that I know that our results are going to help people in our community.
Something I have learned from taking this immersive learning course has been that having a student-led class is really cool, and it's really interesting to see everybody's kind of leadership come out, and the independence factor is really cool. Having a professor there to help you, when you need it, but not having every say in what we do has been it's been a good learning experience overall. And I would say it's just been really fun to have taken this course, and I feel like I've learned a lot about myself and my peers.